Hi, welcome to week 11, part 2 of our lecture. This is kind of where we ended up from the first one. So, point of service plan. A gatekeeper means that all services go through that. So the gatekeeper could be a primary care physician, and they control access to all other medical services. So for example, that primary care may have to see you first before you can see any kind of a specialist. If they do make a referral for services, it's usually someone who's in network only, or they can refer out of network too. Remember though, there's no reimbursement for out-of-network providers unless it's authorized by a gatekeeper to do so. Here's an example of a chart between an indemnity versus a managed care program. So in an indemnity, you have a fee for service. There's no network. You can have whoever you want for a physician. You don't need a referral. You don't need things to get pre-approved or pre-certified. Preventative care may not be covered, and it's pretty high cost to a patient. Then you get the managed care systems, your HMOs, your PPOs, your point of service, and your EPO. And it gives you the networks, and you can see the difference between there. So whatever a person chooses, it's always good to kind of compare what you can and cannot do. But you can see, compared to indemnity, why managed care has become so popular, just due to their ability to manage cost. Regulation of insurance is done. The state controls the legal structure of how our private insurance companies work, and they also monitor their finances to make sure everything is on board with regulations. So the other thing they want to do is make sure that company can meet its obligations to the people it insures. So in other words, you don't want a group of people paying a lot of for premiums and then that health insurance company not being able to afford to pay the claims that come in with this. The private insurance companies are also regulated by federal laws. And remember, federal law may take precedence over state law, but usually it's whichever law is stricter. Federal regulation of private insurance, you have ERISA. Remember, we talked about last week. That permits and regulates self-insured plans, and they have to have minimum standards. So for example, if you have a self-insured plan, you have to be able to have enough money set aside to meet your predicted claims cost and then some above them. So you just can't self-insure and say, oh, I'm not going to worry about it until a claim comes in and then we'll figure it out. They have to have a pool of money already there and have that ready to go. Regulation of private insurance. One of the big things was the Consolidated Omnibus Budget Reconciliation Act of 1986. And that was also called COBRA. And that allowed employees to choose continuation of group health benefits in certain cases. So if you had a job loss, whether you quit or you didn't quit and you were let go, it was still considered a job loss. If you had a reduction of hours, if you were moving between jobs, if you had a death of a spouse, divorce, or other life events. What COBRA does, it guarantees that person the ability to be covered under health insurance due to a loss. Now, it doesn't say how much that person pays. That's up to they are. So COBRA is usually quite expensive because the employer share of what they paid for that insurance could be gone, and that person under COBRA would pay the rest. So I'll give you an example. My brother is reaching retirement age. He wants to retire at age 62. Well, he pushed it back, and he's going to retire about age 64 because of health insurance. He'll be covered under COBRA when he leaves, and at 65, he's Medicare age. So he's got a guarantee that he's going to have health insurance between the age 64 and 65. He knows he's going to pay a lot of money for it for that 1 year, but he's willing to do that. But because of COBRA, he has access to that insurance. Regulations of Private health insurance. Then we had HIPAA. HIPAA was also an amendment to the ERSA. And we talked about that in, I believe, in week 3 or 4 of the course. But that defines protected health information and ensures patient privacy. It also protects people in a group health plan. So you cannot discriminate someone based on someone's health status. It gives more opportunity to enroll in a group health plan, even after loss of coverage after certain life events. It used to be under some health plans, if something happened, you were done, you weren't covered anymore. For some people, it guaranteed access to health care. Then another regulation of private health insurance that came was ARA, the American Recovery and Reinvestment Act, that strengthened the laws and provided penalties for people who didn't follow that. Regulation of private insurance continued. IRSA mandated coverage. There was Newborn Mothers Health Protection Act of '96. That was a plan that offered maternity coverage, must pay for at least a 48-hour hospital stay after childbirth. Now this is big because most of you are probably too young to remember. But there was a period of time when the average length of stay for a mom with a normal birth was 5 days. And that was back in the 60s. When my children were born, that time frame had gone down to 3 days. By the time this act came along, there were facilities that were discharging mothers within 12 hours after birth. And they just said, you can go home, come back, if anything happens. So what this act did was mandated that they have to be covered for at least 48 hours after childbirth. Now, mom may choose to check herself out or leave, that's fine, but they cannot force you to leave before 48 hours. Then there was the Mental Health Privacy Act of '96 that requires equality for coverage of mental illness. Now, that's equality of coverage. It doesn't say what will be covered because mental illness still is not covered very well in a lot of health plans. It's gotten better, but for a period of time, you could hardly find coverage. Then the Women's Health and Cancer Acts of '97 that provided post-mastectomy benefits, including reconstructive surgery. Prior to that, they said reconstructive surgery may not be covered because, you don't have to have that, but it's all part of a woman's well-being. Also, private health insurance, there was the Patient Protection and Affordable Care Act, or PPACA, of 2010. This was also a health care reform law. It said you can't limit or deny coverage for children under the age of 19 with pre-existing conditions. Adults could no longer be denied because of pre-existing conditions. It ended lifetime limits and annual limits on care. For example, a lot of health plans had a lifetime limit of $1 million, and after $1 million, you were still sick. That was too bad. That has been eliminated. In today's world, it doesn't take long to eat up $1 million. It also allowed children to under 26 to stay on their parents' plan. Now, if you look at the date on this is all part of ARA, but it's a little subsection. The reason why they allowed children under 26 to stay on parents' plan, the thought process was they went to college, they're just getting started, health insurance, it's expensive. Now, doesn't say the parent has to allow the child, but they have to cover them up to that age. Some plans provide free access to preventative care. It provided a 50% discount on brand name drugs for seniors in the Medicare donut hole. And that we'll learn a little bit more when we get to Medicare. And then more benefits and everything were phased in through 2014. So that concludes Lecture D. And we will start again with Part 2 of this in our third one. This is a bigger unit, but it's important.